Welcome to the Parkinson Solutions Summit. I'm your host, Dr. Ken Charlin. I'm very excited to introduce a special guest today, Dr. Dale Bredesen. I had the honor of being in one of the very first courses he put on for the RECODE protocol for Alzheimer's disease. Today, what we're going to focus on is a condition called Lewy body dementia, or dementia with Lewy bodies. How that's similar, different from Parkinson's disease and other related disorders, and then ultimately whether it might make sense to apply the principles of the RECODE protocol in patients who have this family of degenerative disorders.
We've had people with Lewy body disease, Lewy body dementia, who've responded nicely to RECODE. You have to focus a lot on the toxins because Parkinson's, Lewy body, these tend to be toxin-related illnesses. Alzheimer's, some of them are toxin-related illness, but many of them are pathogens, P. gingivalis, herpes simplex, things like that. As you indicated earlier, 36 holes in the roof. So there are lots of things that can contribute. But in general, the people who have Lewy body look a little different. They often have visual hallucinations, as you know. Although I find that those are often they're a little bit later. When you see the early ones, they don't necessarily have that, but they often have a history of toxin exposure. They will often have this waxing and waning, as you know, which has been called showtime. They have times where they're really good and times where they're not so good. Even more of a waxing and waning than your typical Alzheimer's patient. What we found is that the two major players, and I think these are important, certainly in Lewy body and probably in Parkinson's as well, but certainly in Alzheimer's, it's about energetics, and there are dozens of things feeding into that, mitochondrial function, blood flow and oxygenation, and then inflammation, the activation of the innate immune system, very much like the big issue in COVID. And so the idea is you need to change where you're in a situation where the energy is too low and the inflammation is too high. You need to change that equation, which is exactly what the approach that we all take does. And so we realize, okay, these different neurodegenerative diseases, whether you're talking about Parkinson's or Lewy body or MSA or Alzheimer, whatever, they're really about supply and demand. And you have a supply that's too low and or a demand that is too high. And so we need to, for each person, identify all these things that are driving this. If your blood flow is not good, if you have sleep apnea, if you're dropping your oxygen saturation too much, if you've got a change in your oral microbiome that's giving you inflammation in your brain, dozens and dozens of these things, you're going to be on the wrong side of the equation. And over time, you will have a degenerative event. But the great news is we should now be able to take the unique biochemistry and genetics of each of these diseases, be they MSA or Lewy body or whatever, look at the Achilles heel. As you know, the Achilles heel in those synucleinopathies has largely been complex 1 of the mitochondria. With Alzheimer's, it's all about neuroplasticity and mitochondrial function and things like that. Now setting up the first precision medicine program for diseases. And so this will include macular degeneration and include Parkinson's and MSA and all the things you've talked about. And I'm hoping it will be up and running by the first of the year. So very excited about that. And I think, as you said earlier, this is an exciting time. Things are changing rapidly. And I think that what's happening is that we have an approach where we can do a precision medicine sort of approach and we can see people get better. We had, as you mentioned, the drug approach, which doesn't really necessarily make you better, but it slows your decline. And I think bringing these together is the future. So we can say, okay, we can come in now, improve your cognition, then we can slowly remove the amyloid. And I think of the amyloid as kind of being yes, it is there as part of the inflammatory response. It is there. It's something that can damage synapses. So in the long run, we'll slowly want to be able to move that out. But the idea of just doing that and nothing else, you're leaving a lot on the table. You can do a lot better than that by getting their synapses functioning better. So I think for the long run, it's going to be very exciting to be able to combine all of this and really get some tremendous and sustained improvements. Alzheimer's is optional. If you're a young person and you want to make sure not to get it, when you hit 40, get a cognoscopy, just as everyone knows to get a colonoscopy when you turn 50. If you've turned 40 or if you're over 40, get a cognoscopy, see where you stand, see where your blood markers are, and Ken, you mentioned something very important. It used to be we have to check CSF markers. So everyone should get on active prevention or earliest treatment. Please don't wait. And we really can reduce the global burden of dementia.
And folks watching this have been to a functional medicine doctor. They may know that very often functional medicine doctors don't take insurance, but I don't want those types of costs to get in your way. Even a Center for Medicare and Medicaid Services has a specific CPT code. That's a code that is assigned to a procedure or a type of office encounter that actually allows, it's basically called a chronic care management code that allows for extended time with your physician. It was specifically designed for cognitive screening and for your doctor to create a whole cognitive care plan by spending more time with you, doing these tests that, by the way, the couple of tests that were just mentioned, they're generally covered by insurance. So don't let these costs get in your way of checking your brain.